Hi everyone, this is Mr. Neil Wrighter, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope, which is due to be launched hopefully in the next month or two. So hopefully by the end of the year. If you are interested in the WAXscope, please feel free to email info@clearwax.co.uk. So this is of a patient who had a very bendy, twisty ear canal, and they've got this really sticky, kind of loose and wet wax and keratin, and we're just using our standard size speculum here, which is a 4.25 millimeter. You can see this keratin at the base of the ear canal is peeling away. So it just got a bit blocked. So with the WAXscope, if you are already trained in performing earwax removal with the use of a speculum, so either by operating it into microscope or head loops, you may be able to use the WAXscope without any formal training, although training is always highly recommended. When we launch the WAXscope, I will put some tutorials onto my YouTube channel, where it's almost like an operating manual, so to speak, where you learn the basics of how to use it. Because the concept really is, if putting a speculum in an ear isn't as easy as people may imagine to straighten the ear canal. So if you've already developed that skill to straighten the ear canal and dilate it using speculum in order to remove wax, then you may be okay without any formal training, but we obviously, of course, do highly recommend training. It's different with the endoscope, the iClearScope, that you most certainly need training, because it's a brand new skill. Quite often have people inquire about the iClearScope, and they feel because they remove wax using a microscope or head loops that they can transfer their skills to the iClearScope, and it's not the case. Many really struggle, and they're very glad in the end that I advised them to come on the training course. So just removing this from the ear, it just got trapped there because it was very bendy. You can just see how hairy the ear is at the entrance. So that's the first bend the second bend you just saw. But I'm just going to the base of the ear canal. You can see all this keratin. It's a bit of a trench here, a bit of a dip. So I'm just going in. I'm going to lift it away. Please be aware, we've had a lot of interest from people on the course now. Our criteria is very strict. We train audiologists, hearing aid dispensers, audiological scientists, hearing care assistants, GPs, physicians associates, nurses, pharmacists, or advanced paramedics who either perform otoscopy as part of their day-to-day job, or already are able to diagnose and prescribe medication for ear infections, who have already enrolled in the earwax removal course. Very strict criteria. We don't train non-clinical personnel, and it has to be those specific professionals that we train. Earwax removal is not trivial, and sometimes we get loads of inquiries from people who believe it probably is, and it's not. I think many things can go wrong, so it's very vital you have a good background in ears. So remove all the wax. You could see the eardrum there. It's very bendy, but even then we were able to manipulate the ear canal with the speculum. And the ear itself is very wet with all the sticky wax. That'll all dry up, but you can see the whole ear canal and the eardrum. Patient can hear significantly better. Again, if you are interested, please do email info@clearwax.co.uk. Thank you.